I've gone through 8 mental health care providers since I was 11 years old. I've had providers ask me if I was addicted to any drugs and then prescribe them to me afterwards. When the behavioral crisis hit, I was currently enrolled in college for my second time trying to make it through. It was even harder to find these resources as soon as the crisis hit because all of these providers went down.
The southern half of the state right now has essentially had its infrastructure for serving behavioral health problems wiped out. When the governor's administration 2 years ago ended the contracts with the existing networks and brought in some Arizona companies, that was very disruptive.
I started in community mental health centers in New Mexico. I was so alarmed by the lack of support that I felt that I needed as a practitioner. The areas that have the most difficult problems, some of the most difficult psychiatric problems that I've cared for, have the least amount of resource available.
The barriers that I went through, it was a lot of barriers, especially with drug abuse, and it's pretty much with just being illegal too. I used to have anger problems because I used to do coke, and I used to pretty much follow my dad's steps. People they got nowhere to run to. If you're trying to get help, you have to go through the system and all that stuff, and it just makes them harder to push them away.
I think that a lot of our crisis in New Mexico comes from the fact that billing in this industry can be a nightmare. If we're trying to do our own billing, almost half of our work is unpaid. I would not necessarily take insurance out of mental health care, but I wouldn't let them regulate it the way that they do.
To the policymakers, I'd like to say that they look at the issues around healthcare not just from the standpoint of the cost of the care, but from what people say they actually need and what actually works for them and what doesn't work.
I think New Mexico needs a strong behavioral health system because there's so much poverty going around that a lot of people don't acknowledge. If we were to fix the system, it would probably bring a lot more success to our economy.
When I was incarcerated and I got out, the only place I could have run to that I know, it was La Placita. I used to be homeless, and if you're homeless, just the best place is to go Placita. Placita will help you with it. If you can't find a job, they will help you with a little bit of job, maybe with the voluntary work, but they will find ways.
The audits perhaps created an awareness of some of the problems within the system, and now those can be addressed.
If I had the opportunity to draw from scratch the behavioral health system of the state, my vision for it would actually be one that focused a lot of its energy on prevention. The message is let's not dwell on the old mistakes. Let's move on from here and not do it again. And let's find a way to create a system that's viable and sustainable.